What are you seeing in terms of the Florida cases? How localized are there, and how much is just community spread that's everywhere in the state?
Well, there's significant community spread. It's definitely worse in the more populated areas, but we've had some issues in our rural areas too, particularly with individuals who are in the migrant farming community.
How are you protecting Florida's elderly population, which is one of the biggest in the country?
Well, there were efforts initially to focus on the congregate care facilities, and in effect, they've been locked down. The problem we had initially was that workers coming in and out were spreading coronavirus. So now there is a mandated testing for all those facilities, and we have it under a little better control. I think that was a really important step for Florida to try to decrease the death rate from COVID.
Are there efforts underway for contact tracing, Dr. Levine, in any way that is effective at isolating cases and controlling the spread?
There have been efforts, and the infrastructure wasn't really there to do what we needed to do. There have been efforts to add workforce and to increase the capacity. But right now, quite frankly, with the rapid rise in cases, I don't see how contact tracing can keep up with this and do what it's really intended to do, which is to snuff out smaller outbreaks before they get larger.
So what is the hospital situation there? Are they equipped? Is there enough capacity to deal with it, enough beds?
There is for the moment. Florida has a good bed capacity in general. Like many other areas, when elective procedures started up again, the hospitals got very busy because there were a lot of people who put off procedures and put off care. So the hospitals are pretty busy right now. They do have capacity. The challenge is that we've seen pretty rapid rise in cases, and we're starting to see younger people in the hospital. Now, that's better than having folks who are more vulnerable and older folks in general, because they tend to last longer in the hospitals. The younger folks are staying less. But the problem right now is we're seeing the beginnings of the spread from the younger population to the more vulnerable and older populations in Florida, and that's very concerning.
Dr. Levine, Dr. Fauci today did mention this idea that the task force is looking at pool testing people, mixing together a number of samples, say 25, and testing them as one to figure out whether you need to test people individually. Is that something that could work and could mitigate the spread?
It doesn't mitigate the spread. The issue with testing that we need is a rapid turnaround. So in that we could do more testing and potentially turn it around quicker, that may be helpful. We've definitely ramped up testing in Florida. I think there were over 70,000 results that came back today. But the problem is that the percentage of those positive is going up, meaning that we have more disease in the community and in all likelihood, a lot more community spread.
Also wanted to ask you about some news that's coming out of Europe. The New York Times is reporting they're very close on putting in place a policy that would ban travelers from the United States going to Europe. Is that fair?
Well, I can understand that. It's really unfortunate that we're in the situation we're in. Your last speaker talked about we know what to do. We just need everyone to do it. This is a health issue, not a political issue. We actually have more evidence now than ever that wearing a face covering can be extremely helpful. But we need large percentage of our community population to do that for it to be effective. So if we could do the things that we know will work, the physical distancing, the face coverings, and the hygienic practices, we could potentially keep this economy going. But right now we're in a pretty bad place, particularly if we can't get people mobilized to do what they need to do.